KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Alice Wertz. Recently, the FDA approved the first ever treatment for Rett Syndrome, a rare and debilitating neurological disorder diagnosed almost exclusively in girls. Our guest today on As Prescribed is Dr. Jennifer Martelle Tu. She's a pediatric neurologist at UCSF Benioff Children's Hospitals, as well as the director of Katie's Clinic for Rett Syndrome at UCSF. It's one of the very few centers in the country that cares for children diagnosed with this condition. Thank you so much for joining us today, Dr. Tu.
It's my pleasure. Thank you for having me.
Can you tell us what is Rett syndrome?
So Rett syndrome is a genetic disorder. It affects a specific protein that's throughout the body, but primarily in the brain. And this protein is really important for maintaining neuronal function. It's very important in mature nerves to help facilitate the synapses or connections between nerves. And what happens is when there's a mutation in this protein, the nerves don't function like they're supposed to. So while it has effects throughout the body, it's primarily considered a neurodevelopmental disorder. And typically there's normal development in children for about 6 to 18 months. And then unfortunately, they experience a regression or loss of certain milestones. And that can last anywhere from 6 to 12 months of that regression phase. And then afterwards, it's not a degenerative disorder, meaning it doesn't continue to worsen. So after that initial regression phase, these children can then go on to learn additional skills, though they will always have significant deficits, primarily in their communication skills and in their fine motor skills.
So how about this new therapy for Rett syndrome? What is it and how does it work?
So we're very excited about this. So DAYBUE just became available earlier this spring of this year. And this is a medication that you can think of it like a disease-modifying medication, similar to what we use for diabetes or multiple sclerosis. It's a medication that must be taken every day. And the goal from this medication is to reduce the inflammation and cell death that happens in neurons that are affected by this mutation of the MECP2 protein.
What does it mean for the patient themselves? How does it affect them? And how does it affect their community, like their family and caregivers?
That's an excellent question. So this medication has, it's undergone rigorous trials, which is why I got the FDA approval. And primarily what we see is an improvement in social communication skills. We're seeing improvement in fine motor skills, and we're seeing improvement in some of the breathing abnormalities that can happen in this condition. And it's just so wonderful for this community because, it's a small community. This disease happens in about 1 in 10,000 girls in the United States. So it's not a very big community. And when you have a condition where it's a genetic condition and it's a small community, there's often not a lot of research or publicity or awareness of the condition. And so to have a medication that's now available for this community, it's just the first step in what we hope will be the road towards a cure.
You've been director at Katie's Clinic. Tell us who Katie is and why it's named after her.
So this is one of our pride and joys. This clinic has been around for about 20 years, and that coincides with the age of Katie. Katie happens to be one of the first patients in our clinic who has Rett syndrome, and her family has been just tantamount to the survival and continuation of this clinic.
Wonderful. What else should we know about Rett syndrome? It's unique in that it primarily affects female pediatric patients. Is that right?
That's correct. So this protein is on the X chromosome. And so primarily it's going to affect girls because when you have a mutation on the X chromosome in boys, it often leads to a fatal condition. That being said, there are definitely boys who do have Rett syndrome. It's a much smaller population, but it can affect boys. And the other thing about this gene is that the Rett syndrome is caused by a mutation leading to a reduction in the amount of the protein, but there's also a condition called MECP2 duplication syndrome where you have extra, and that is something that can also affect boys.
So the medication, is it effective in terms of slowing down the disorder, the disease, or how does it impact the patients?
So that is a little bit beyond what we fully understand. We're still learning a lot about this condition, primarily the genetics and how it changes throughout the lifespan of a patient. But this medication specifically is targeting an insulin-like growth factor molecule that helps to stabilize the neuron. So it helps to reduce inflammation in the brain. And so it's something that would have to be continued throughout life to continue to see benefits from the medication. It's not something you could take one time and have a lasting effect. But if it reduces inflammation, then potentially if the nerves survive longer and the connections are stronger, right, then the amount of skills and abilities that the girls can relearn and experience throughout their lifespan is quite significant.
There's another unique feature about your clinic. Tell us about that.
We are part of a children's hospital. So traditionally, you think of clinics at Benioff Children's Hospital of seeing pediatric patients. Well, our clinic is unique in the fact that we see patients of all ages. We have adults in our clinic. We have 40-year-olds in our clinic. And the primary reason for that is we are a multidisciplinary center where we have multiple specialists that all come together in one setting. But there's really nowhere else for these patients to go. There's no other clinics available that provide treatment for this condition. And so we see patients as soon as they're diagnosed, well into adulthood.
That's very unique. It's fantastic that you're keeping up this wonderful work. And with the debut of Debut, a new medication to serve these patients with Rett syndrome, it's wonderful that there's opportunities for growth and managing this disease and disorder. Thank you so much for joining us today, Dr. Tu.
It's been a pleasure. Thank you.
We've been speaking with Dr. Jennifer Martelle Tu. She's a pediatric neurologist at UCSF Benioff Children's Hospitals and director of Katie's Clinic for Rett Syndrome at UCSF. You've been tuning in to As Prescribed. I'm Alice Wertz.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.